Hello, my name is Lori Koppelberger, and we're doing a video journal today on a scholarly article for Abnormal Psychology, a summer online course with Dr. Sterling Watson at Chicago State University. The article that I chose was the long-term outcomes of obsessive-compulsive disorder, and it's a follow-up of 142 children and adolescents. There are a few studies like this one talking about the duration and the follow-up of the disease process. It takes into account a few other things as well as just the persistence, correlated other mental diseases or illnesses, the relevant predictors that are associated with OCD, disruption in daily life functions, the use of services by the participants, and if the patients felt like they were getting proper treatment at the follow-up. Since OCD is often diagnosed in early childhood or in adolescence, early and proper treatment for these individuals may provide an increased chance that they will be less affected by the illness in a chronic state in adulthood. The method of retrieving the information, including the baseline at diagnosis, and they use the ICD-10 criteria, which would be similar to the DSM here in the United States, the Children's Yale-Brown Obsessive-Compulsive Scale, the Strengths and Difficulties Questionnaire, the Patient's Global Impression, and the Work and Social Adjustment Scale. The mean length of the time between diagnosis, the baseline, and the follow-up was 5.1 years, and the median age of the follow-up was 18.6 years old. So each of the scales that I mentioned earlier rates the different sections of the study and is compared to the baseline when the participants were diagnosed. The results were that 41% of the participants had a persistent OCD at the time of follow-up, and it also found that 40% had an additional mental illness along with the OCD. The relevant predictor of persistence, and this really blew me away, is the actual duration, not the severity of OCD. So the time that they've had the disease is more of a clue to how persistent it will be going forward into adulthood. Approximately one-half of the participants were still receiving treatment, and about half of the participants felt that they needed more treatment at the time of follow-up. Overall, the conclusion is that early diagnosis and treatment may provide a decrease in the chronic disease states of OCD going into adulthood. So pretty important. My impressions of the study. The study is important due to the time-sensitive nature of diagnosis and treatment of OCD for children and adolescents. If there is a way to slow the progression or to even remedy the disease before reaching adulthood, it would definitely be a priority to provide more studies like this one to see if there's any other factors that can be put into that to decrease the long-term persistence of the disease. I think that the numbers may be a little skewed due to the families that turned down the invite to participate in the study. It's possible that those who did participate were maybe receiving more appropriate treatment and had better family or social support, thus better outcomes. I'm a little concerned that there might be a little bit of a bias there. Critical engagement. Although the study used appropriate methods for retrieving the information both at baseline and follow-up from the participants and was able to make unbiased conclusions based on that information, there is still the question pertaining to those that did not participate in the study. The total number of participants that were available for the study were 276. Those are the ones that had the baseline done at diagnosis. Of these, 45, or 16%, were unreachable in any manner. They could not contact them to do the follow-up. The portion of participants that interest me the most are the 89, or 38.5%, that declined the study. Of those, the reason for decline was not having time or family difficulties. Could be a problem with OCD. That was 11 of the groups, or 12.5%. and the others that had no apparent reason for a decline, which were 64 or 71.6%. That's a lot of the participants that declined the study, and I would be interested to see if the follow-up from them would be different and the outcomes of the study would be different with the persistence of the disease. So the fact that only 61.5% of the original 276 patients that they had the baseline on participated just makes me wonder again about the willingness to participate in the study, if that's related to the family support and care that the individual was receiving for OCD. So I believe that more long-term studies are needed to maybe prevent this persistent OCD or having it become a chronic state in adulthood, in hopes that maybe if we can come up with the therapy or continued therapy to alleviate the chronic state of the disease, I think it would be extremely helpful for society in general, as well as those individuals suffering from OCD. And I also believe that the study needed to pay a little more attention to the type of therapy that the participants were receiving, and maybe have a little more of a set of rules on what they said therapy that they were receiving, so that that could be broken down, so that treatment going forward would be a little more selective per each person and how they were dealing with the disease. So all in all, I would say if we can stop OCD going into adulthood, I think these long-term studies are definitely worth continuing on with. Okay, thank you. Bye.